Here are 9 mistakes you're making while measuring your blood pressure. Number 5, texting, talking, moving, or other distractions while getting your blood pressure taken. Yes, this can be a problem at home, and it can be a problem if you go to an office. What happens is this: if you are moving about, if your mind is other places, if you're fidgeting, if you're distracted, if you're having conversation, then that can give you a falsely elevated blood pressure. How do you correct this mistake? Sit still and be quiet, please. It's not that hard. Okay, maybe it's hard, but you really have to do it for your health. What you should do is relax, just have slow, deep breaths, not only while you're getting your blood pressure taken, but for at least 5 minutes. You want to sit down and do not multitask, do not fidget. This will give you an accurate reading, because the last thing you want to do is to be talking, texting, fidgeting, and then you go in and the doctor tries to give you medicines that you don't need, when really, had you just taken a beat and been calm and quiet, you could have had a more accurate reading. And again, this is not only advice for when you're at home, but also for you to advocate for yourself. Because a lot of times when the nurse's assistants are taking your pressure, they're under pressure in order to get things done, and they'll be asking you all kinds of questions while they're taking your pressure. So you can politely ask them, please, I'd like to be quiet while I'm taking my pressure. Can you please retake it? Okay? You better advocate for yourself. No texting, no talking, no fidgeting while taking your blood pressure. That's a mistake. Number 6, now this is a dangerous one: only taking one reading and trusting it. Now, this is a problem because, yes, we know that blood pressure can fluctuate throughout the day, but also from minute to minute, depending on your position, it might change. And so if you take just one measurement and that's it, and then you act on it, then it could lead to you being over-medicated or under-medicated. So it's important to take multiple readings. Here's how you remedy this mistake. Check your blood pressure multiple times, 2 or 3 times, and make sure you give it a minute or 2 in between each reading. If most of the readings are similar to each other, then the most common readings are probably accurate. If all of the readings are all over the place, check it in the other arm. And if you're still having issues, consult with your physician. At any rate, don't ever just take one random reading and make major changes. Check the blood pressure multiple times. Number 7, measuring blood pressure right after consuming caffeine, alcohol, or tobacco. Here's the issue. When you are drinking coffee with caffeine, a soda with caffeine, when you're having yourself some spirits, some alcohol, or when you are smoking a cigarette, all of these things can cause a temporary rise in blood pressure. How to remedy the situation, okay, how to correct this mistake? Make sure that you wait at least 30 minutes after consuming caffeine, alcohol, or smoking a cigarette before you check your blood pressure. And please stop smoking cigarettes altogether. They are on the risk factor list for just about everything: heart disease, lung cancer, cervical cancer, kidney cancer, emphysema, COPD. Okay, this is your public service announcement. Stop smoking cigarettes. Question: what is the one change that you will make when taking your blood pressure at home after watching this video? Please comment down below. Number 8, taking your blood pressure with a full bladder. This is a common one because a lot of times patients will wake up in the morning with a full bladder. They'll check their blood pressure before they use the restroom, or patients will go to the doctor's office and they anticipate that they might have to do a urine sample. And so they make sure that they hold their urine, they get their blood pressure taken with a full bladder just in case the doctor asks for a urine sample. Well, this is a no-no because guess what? Having a full bladder can increase your blood pressure by as much as 10 to 15 points, by as much as 10 to 15 millimeters mercury. That's a big deal. So how to correct this mistake? Always empty your bladder before checking your blood pressure. Number 9, not remembering to keep a consistent log of your blood pressure readings. This is important. A lot of times we get caught up with our busy days and we'll take our blood pressure maybe only when we're stressed out, or maybe we'll only remember to take our blood pressure when we're actually taking our medicine and being compliant, or we might actually double up on medicine because we know we haven't been compliant and you only take the blood pressure readings then. This is a no-no. It's important for your doctor to really see accurate blood pressure recordings throughout the days over several days. And that is the best way for you to be managed. So how do you correct this mistake? Make sure you give yourself a reminder, have a dedicated notebook where you record your blood pressure readings, or a spreadsheet or an app, and actually set a little alarm to remind yourself to take your blood pressure at those consistent times each day and to write it down. To learn more about blood pressure, make sure you check out my many YouTube videos on blood pressure, including the truth about high blood pressure and how to lower your blood pressure naturally. If you found this information to be helpful and informative, please be sure to like this video and to share it with the people you care about. Also, if you have not done so already, please be sure to subscribe to my channel. Again, I am a board-certified kidney doctor and high blood pressure specialist, and so taking care of patients with high blood pressure is what I do day in and day out. I've just shared with you 9 of some common mistakes that people make while taking blood pressure. And I want you to share this information because it will not only help you when checking your blood pressure, but it will also help you and your loved ones to advocate for themselves when they go to their doctor's offices and when sometimes mistakes are being made there. Hey, everybody's human. I want you to take notes and really try to commit some of these common mistakes to memory so that you will do better. And as always, I thank you for your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frida.